This is day 7 after having prostatectomy surgery. Yesterday, fell asleep before I did a video. My apologies. Yesterday was a big day. I went to the doctor, got my catheter removed. That was nothing like everybody said it was. Didn't hurt. Wasn't nothing. Happened real quick. It was over with. I dripped a little bit of pee dripped out when they did it, and that was about it. I had brought a pad to wear home and put that on there, and the doctors at UC Davis told me that my cancer, the micro thing, whatever, where they looked at it through a microscope or whatever they do, results were back, and I didn't have cancer. It doesn't look like I had cancer in any of the lymph nodes like they thought it had moved to. I only had cancer in the prostate, which was significant. And they did tell me that they went up when they did the camera in my urethra up to my bladder. There was no cancer in my bladder. So they feel like at this point they got everything. I won't know for sure until September 2nd or roughly right before that when I do a PSA. That's as soon as I can do a blood draw and they can read my PSA level. As long as it's under 2, I should be fine, they're saying. It was 0.88 before the surgery. If not, I will have to do some other type of treatment, and we'll go from there. Keep my fingers crossed, hoping God that, this is it for now. I will have to be tested all the time for the rest of my life now for cancer, though. But it was a good thing. They said they got it all, and it wasn't in my lymph nodes. So I'll keep saying that, but just want to let you know that. Today, that was my doctor's, this resident from UC Davis that told me that yesterday. My actual surgeon called me today and told me basically the same thing, except for my cancer was more aggressive than they thought at first. And it was over 50% of my prostate had cancer. And that there's a 50% chance that possibly it's still somewhere. So that was not good news. It kind of bummed me out, but I know they have to say the worst. So she said they did exactly what they wanted to do, and she was happy with the results as far as getting out everything, and she didn't see that the cancer had moved anywhere from my prostate. But it was more aggressive than they thought. So once again, 90 days before I can do a blood test. And as far as once the catheter's out, yes, I was up like 3 or 4 times last night going pee. It hurt to get started. It's kind of hurts to start going pee, but I was able to control, for the most part, everything. I'm doing physical therapy to learn how to control my muscles that will, let me go pee or whatever, and all that good stuff. If I coughed, laughed, farted, any of that stuff, you seemed like I pee a little bit right now, which is common, they said. So it's not that bad. I brought the pads with me. Some blood. I said that's common. There will be some blood loss, a little bit of blood in your pee after they take the catheter. So that's where that is. It's better than I thought it was going to be. I thought it was just going to be draining all the time or something, but it isn't. You're able to stop the bladder from going pee, and I'm happy about that. And I hope anybody else that has this surgery has the same results, or better. No pain medicine no more. They did say I can't go back to work till July 13th. Yeah, which is fine. I'm okay with that. I just didn't realize it was going to be that long. I thought it was going to be less time, but nope. July 13th is my return to work date. So all I'm doing now is going to do therapy. I got to do the therapy to help control my muscles, or learn how to use my muscles that are part of my the muscles that will be used to go to the bathroom to pee. And they said, the surgeon said to expect it to get worse as far as drippage goes before it gets better, because right now the urethra and all that area where the catheter came out is inflamed a little bit, so it's helping keep some of the drainage going out because it's probably swelled up. Once that gets better, then swelling goes down, there might be more drainage, she said. But by then I should start to be able to control it for most things. It's not real bad though. Anyways, that's it. I'm sorry I forgot to post yesterday, but this is day 7 after having a prostatectomy. I was very happy, not in the lymph nodes, only on the prostate. So was my cancer. So anyways, I'm gonna let you guys go for today. I will definitely get back to doing it every day for the time being until I feel like we can go farther. No pain, really. Just walk, take it easy, and walk. That's what you got to do. Drink water. All right. Thanks, everyone. Bye.